Aloha, my name is Ruth Ellen Klinger-Bowen. I'm filling in for Dr. Clyde Tumaru, who is the principal investigator for this project titled Mitigating the Diseases of Freshwater Cultured Fish Species in Hawaii and the Pacific Region. Besides Dr. Tumaru and myself, our project working group is Kathleen McGovern-Hopkins, Dr. Bradley Fox, Dr. Jim Brock, Nathalie Lynn Antonio, Dr. Lei Yamasaki, and Dr. Esteban Soto. This was a one-year project which began May 1, 2012 and ended June 30, 2013. Our funding support came from the Center of Tropical and Subtropical Aquaculture. However, we would like to recognize and acknowledge the many departments and agencies that supported us, such as the College of Tropical Agriculture and Human Resources, USDA, Moana Technologies, Ross University School of Veterinary Medicine, and the Hawaii Department of Agriculture. The overall objective of this project was to study the incidence and prevalence of a Francisella-like bacteria that affects our Hawaiian fish and the fish in the region. There were three objectives, which I will go into detail in this presentation. The overall objective of this project is to study the incidence and prevalence of a Francisella-like bacteria that affects the fish in Hawaii and the region. There are three objectives, of which I will go into detail and the results in this presentation. Francisella is a fairly well-known group of bacteria that infects both freshwater and marine fish worldwide. The overall objective of this project is to study the incidence and prevalence of a Francisella-like bacteria that affects the fish in Hawaii and the region. There are three objectives to this project, of which I will give you the results in this presentation. Francisella is a fairly well-known group of bacteria that infects Our first objective is to determine how Francisella impacts farmed fish on Oahu and the outer islands using PCR testing and histology. Our project working group learned several things. But before I get into the results, I want to mention that the Francisella-like bacteria, or FLB, has been described. It is now Francisella noatunensis subspecies orientalis, or FNO for short. Let's simplify things for the rest of this presentation and mention it as FNO or FNO DNA. Our first objective is to determine how Francisella impacts farmed fish on Oahu and the outer islands using PCR testing and histology. Our project working group learned several things. But before I get into the results, I want to mention that the Francisella-like bacteria, or FLB, has been described. It is now Francisella noatunensis subspecies orientalis, or FNO. For the rest of this presentation, let's simplify things, and I will mention it as FNO or FNO DNA. One of the first things we learned is that there seems to exist an asymptomatic carrier state in some cultured and feral Tilapia populations. These are fish that appear normal on the outside and do not show any signs of disease. However, their DNA reveals they were exposed to FNO at one time in their life. We also found that the asymptomatic carriers of the FNO DNA can remain at least a year after recovering from an initial clinical outbreak of the disease. This graph shows a year sampling of a Tilapia population from a private aquaponics system. We also sampled several sites around Oahu of the wild populations of Tilapia, which is the black-chin variety. Interestingly, we found that over 60% harbored the FNO DNA, which is labeled A on the graft. Among cultured stock, there appears to be differences among the different Tilapia species. The golden variety, which is labeled B on the graft, had the highest prevalence of FNO at 45%. The Tilapia variety, labeled C on the graft, was at 20%. Although sample sizes are lower, the blue and the pink bellies or Niloticus, labeled D, has not revealed the presence of FNO in their DNA. However, further testing of these species may be warranted. Probably the most significant finding to date is the control of the bacteria in an aquaponic system. Since there is no approved drug that would be useful in an aquaponic system, we found that if all fish are removed from an infected system and laid fallow for 2 weeks, it may be a means of ridding the system of the pathogen. This graft is one example of this control method for an aquaponic system. At the onset of clinical disease, all the fish were removed. After 2 weeks with no fish, the tank was restocked with known FNO-free tilapia stocks. These fish were periodically sampled, and after 7 months, there was no signs of disease, and their DNA revealed no FNO. Although sample size is low, there is preliminary evidence that the pathogen may not be vertically transmitted. That is, although the parents may have the FNO DNA, it is not transmitted to the offspring. Also, as previously suggested, there may be a tilapia variety of varieties that are more resistant to the disease. For instance, when clean or FNO-free stocks of the blues were exposed to asymptomatic carriers, as well as during an active infection, they did not experience any mortalities or clinical signs of the disease. However, further investigation into their DNA did reveal that they did have FNO. This map of Hawaii shows all the FNO positive and negative cases since 2010. With the exception of one FNO positive result on Molokai, the remaining islands still appear to be FNO free. This map of Hawaii The second objective of this project is to determine if the FNO bacteria could also be found in other freshwater marine species in Hawaii. This chart is all the species we've collected to date. They are from marine, estuarine, and freshwater environments around Oahu. All but the catfish, listed as the last 2 on the chart, were wild-caught. The catfish were cultured. Most of the fish species were negative for the FNO bacteria. However, a marine wild-caught barracuda and a cultured site of Chinese catfish were positive for the FNO DNA. This indicates both of these species were exposed to FNO at one time. Whether it causes clinical disease and mortalities is yet to be determined. Objective 3 was to disseminate our results into information to the public. In the past year, we've had 3 presentations, 2 of which was presented by a CTAR graduate student, Bik Nak Tai Tran. A third was presented at a conference in March at the Windward Community College by Dr. Tamaru. Objective 3 is disseminating our results into information to the public. In the past year, we've had 3 presentations, 2 of which was presented by a CTAR graduate student, Bik Nak Tai Tran. A third was presented at a conference in March at the Windward Community College by Dr. Tamaru. One peer-reviewed article was published during this past year, senior authored by Dr. Soto, in the Journal of Aquatic Animal Health, titled Prevalence of Francisella noatunensis, subspecies orientalis, in cultured tilapia on the island of Oahu, Hawaii. One workshop, Aquaculture of Tilapia in Hawaii, was completed on March 16, 2013 at the Windward Community College. It was jointly held by the Hawaii Aquaculture and Aquaponic Association, Windward Community College, and CTAR. This workshop attracted 108 paid participants. One of the outcomes for the Aquaculture Tilapia in Hawaii conference was to obtain stakeholder input regarding how to increase and diversify Hawaii's tilapia industry. One conference was completed during the reporting period. Aquaponics in Hawaii was held at the Windward Community College on May 25, 2013, and it was a sold-out event. A total of 216 participants took part in this CTSA co-sponsored event. Information about this conference, such as the speakers, agenda, and co-sponsors, and copies of the PowerPoint presentations, can be found at these websites. This project has raised awareness of the FNO pathogen among stakeholders, both at the commercial level and with our backyard aquaponic systems. Some commercial farms have begun initiating a self-imposed FNO monitoring protocol, utilizing this PCR testing at their own expense. With this process in place, one farm has already begun to market their fish as FNO-free. I'd like to thank CTSA for funding this project. I also want to acknowledge our project working group and their affiliates. Mahalo.